Let me ask you this. Do you think it is possible that if a company does this type of drug testing, that, you have those young kids. We assume they're young kids. I don't know. Maybe old people are just as prone to it. Doesn't matter. So, but you have that young 22-year-old kid who doesn't take drug or hasn't, barely ever, but so he's thinking about it. Why? Because he was at this party or this and that. But then he knows his business, the way he works does drug testing. Do you think that it actually will help some of those, not hardcore gang members, drug members? We're not talking about those guys. They probably wouldn't work there anyway. But, the guys who are like, should I not? A little bit like with drinking. It just happens. You drink one too many. That yes. it will deter some of them from actually ever going on drug simply because they really are not into it anyway, and because they get testing, so a little temptation kind of gets, no thanks, but no thanks.
Actually, your picture is perfect, and that's exactly what occurs. Certainly, a random drug screen program certainly keeps the honest people very honest. And if you have somebody that's a drug user, eventually you'll probably demonstrate that to them. Now, if a company has a positive drug screen that has to be dealt with, then certainly we can help them in terms of advise them as to what that person can do, what they cannot do, by way of safety-sensitive positions in their firm. As well as to assist them with a remedy in having a drug and alcohol counselor give them counseling so that they can get back to their normal position as quickly as possible. And so just because a drug screen is positive doesn't mean that an employer has to fire an individual. And a lot of employers do not do that. They certainly give the employee the opportunity to remedy the problem. And we can assist in that process as well.
Beautiful. We may be talking about that a little bit later of how we can assist them. But for now, I really appreciate this information. Extremely informative, extremely interesting, and very candid. Thank you very much, Dr. Ennis.
Thank you.